Hello YouTube world, this is Miss Patty from For Your CNA, and I'm here with today's question of the day. Before we get to that, let me remind you to stay tuned to the end of the presentation so that we can congratulate all of the people that have let us know that they passed the state exam. And if you've passed the state exam, go to any of our videos and leave a comment in the comment section letting us know that you've passed, and we'll be happy to congratulate you on an upcoming episode. If you have a question that you think would make a good question of the day, leave your question in any of our video comment section, and we do choose one question every day and answer it in video format as the question of the day. But if you leave us a question or a comment, make sure you head over to that subscribe button and ring the bell so that when we post the answer or your congratulations, you're notified. So on to today's question of the day, which was posted by Kim B. And Kim asks, can you please explain to me when to raise and lower the bed? And this is kind of a little bit more complex question than it seems on the surface. So the first thing that I want to do is point out that in our skills book, and that's here, the CNA Skills Study Guide, and this is a book that I wrote for CNA students. It's used by schools all over the country. On page 104, I actually have a lesson specifically on this topic. So you can head over to our website, and that's foryourcna.com, and you can order this book so that you have access to all of the lessons. But let me give this to you in a very short video format. The thing about hospital beds and beds that we use in healthcare is that they have a lot of different types of adjustments. The head of the bed can go up and down, the foot of the bed can go up and down, and the entire bed can be raised and lowered for ergonomics or for your comfort while you're performing skills. And this is a really nice feature, but those beds are not found in all settings. So some states, particularly prometric testing states, don't require that the bed is raised to a comfortable working height for any of the skill because they understand that these beds are not found in every single setting, so they don't have it as a tested checkpoint. Now you can, if you choose to, raise the bed to a comfortable working height for any of the skills that we're going to do. But if you do raise the bed to a comfortable working height, don't forget to lower it at the end of the skill, because what you're actually doing is moving the floor. You don't think of it that way, but from the patient's point of view, that's exactly how it's going to seem. Think about yourself for a second. When you get into bed, you swing your legs in, you go to sleep, you wake up in the morning, you're groggy, swing your legs out of bed, and that floor is always right where you left it, has never ever moved on you ever. Well, your patients have the same experience. So when they swing their legs out of bed, they expect that floor to be exactly where they left it when they got into bed, because it's never moved on them ever. So if you raise that bed to a comfortable working height and then forget to lower it again, what you've done is move the floor. So when the patient gets out of bed and they're groggy and sleepy and maybe even medicated, that floor is not going to be where they expect it to be, and that can actually cause a fall risk. So if you raise the bed to a comfortable working height, which you can do for any of the skills, make sure that you lower it at the end of the skill so that you don't fail for safety. I hope that helped. If this did help you, make sure you give us a thumbs up and let us know that our content is valuable to you, and that way we know to continue making this type of content. Now, I do want to talk about this for other states, though. So that is for prometric. Prometric does not require that you raise the bed to a comfortable working height, but there are a few states out there that do require this as part of their CNA testing. So if you are in a state that requires the bed to be raised, it's actually going to be indicated on the clinical skills checklist for your CNA testing in your state. So you've got to find out who you're testing through. Is it Prometric? Is it Pearson VUE? Is it Headmaster? Or do you have there are a few states that have independent testing, and then you go to that website and download the clinical skills checklist for your particular state's skills, and it'll give you that information about whether it's required or not. Now, for prometric states, you can raise the bed for any skill that requires bending or stooping for an extended period of time. So think about respirations, pulse, all the range of motions, making an occupied bed, side-lying position, pericare, catheter care, partial bed bath, those types of skills that require you to stoop over the bed for a long period of time. You're not required to raise the bed, remember, for prometric states, but you can if you want to. Just remember, if you raise it, have to lower it. So I hope this helped clear that up for you. And if it did, make sure you give us a thumbs up. And now we're on to today's congratulations segment, and this is my favorite part. So today we have 3 people we want to congratulate. These are people that let us know on our YouTube channel in the comments section that they passed the state exam. So if you want us to congratulate you, head over to any of our videos, leave a message in the comment section. We'd be happy to congratulate you as well. Make sure you hit the subscribe and ring the bell so that you know when we post a video for you. So the first person we want to congratulate today is Marites808, who passed the state exam in Hawaii, and this is super exciting. And she says, thank you for your step-by-step instructional videos. I couldn't have passed it without your videos. And we want to say, Marites, welcome to healthcare and great job. We're very proud of you. We also want to congratulate Shanna R., who had her test on Friday the 13th. And I'm so glad that she didn't let superstition hold her back from passing. And she says she passed with flying colors and thanks us a lot for the videos. We're so happy that our videos were a help for you as you prepared for the state exam. And Shanna, good luck in healthcare. And finally, we want to congratulate Deborah L., who passed her exam 3 days ago and says she watched our videos over and over and followed all of our steps and passed. And we want to say congratulations, Deborah. And one of the things that makes us a little bit different than other videos out there is because we are focusing solely on exactly what is required for the test. So make sure you keep that in mind when you're watching our videos, is that we are geared to help you pass the test the first time. So thank you for joining us today. Remember, if you have any questions or comments, leave them in the comments section below any of our videos. We'll be happy to respond, and we might feature you on tomorrow's Question of the Day segment. And if you've passed a state exam recently, let us know that too, because we just love sending out congratulations. So until next time, happy caregiving.